since we're already here, we might as well talk about groin checks. I've mentioned groin checks in a couple of my ICU shift recaps, and I've had people be like, what the heck is a groin check? Sounds weird. It's not. If you're a nurse that takes care of patients post-cath lab or post-interventional radiology, you're gonna wanna know this. A lot of times during these procedures, the provider accesses the patient's vascular system through their femoral vein or artery, which is in the groin. A lot of times during these procedures, there is a sheath that is inserted. These are bigger than your typical like IV. And a lot of times during these procedures, patients are getting blood thinners as well. Not always, but sometimes. What I'm getting at is that combination puts patients at risk for bleeding post-cath lab, post-IR. So when this patient comes to you, a lot of times you are going to be performing frequent groin checks to make sure that patient is not bleeding, not getting a hematoma, or there's nothing else going on that is abnormal. Now, follow your hospital's policy, but typically groin checks start off at Q 15 minutes, and then they'll go to Q 30, then Q1, and it involves these couple things. First, you are going to be assessing the site. Now, this is a blank site that hasn't been accessed, but typically there's going to be some sort of dressing on there, usually like a little gauze, little transparent dressing. We're going to visually look at this spot and notice if there is any bleeding. You are also going to want to gently kind of palpate this spot and make sure there's no hematoma forming. This spot should be nice and soft, okay? If you start to feel like some hardness in there, especially if it's growing, this is a sign that there is bleeding internally. I also recommend that you kind of put like a piece of gauze or a surgical towel down in this patient's groin, kind of this crevice right here, because sometimes it can bleed and kind of sneak down in the groin, and patients and nurses may not even notice it. I want to assess this right away when you get this patient to make sure you have eyes on what this groin site looks like fresh. We're also going to want to check the patient's pulses distally, so typically in their foot. I also like to make sure that they still have sensation and they can feel everything. Good habit to get into is comparing both sides, so that way you can feel what both sides feel like, and that way if something gets a little off with the one side, you're aware. Looking for bleeding, we're looking for hematomas, we're looking for good pulses, good sensation, good feeling. We are also making sure that our patient's vital signs look okay and that they don't have any like extreme back pain. This could indicate that the patient may have a retroperitoneal bleed. Also going to be following post-cath lab, post-IR orders. So typically the patient's on bed rest, they have to lay flat for a certain amount of time because we are trying to limit them lifting this leg, causing increased pressure in that groin, or sitting up, again, causing increased pressure in that groin spot. If you do notice bleeding, you do notice a hematoma, you do notice this extreme back pain or anything wrong with the patient's pulses or anything, definitely notify the provider, call for help. I'm gonna make a whole separate video on what to do if your patient's groin site is bleeding. So stay tuned for that video.